What initially got me into aesthetic medicine now and evolved over the last 20 years, I was a general practitioner for about 20 years, and then I was looking for something else to complement or to supplement my income, and then I did a Botox course 2008, and I really liked it. I got into it and I enjoyed it, and from there on I just did it more and more. I did every aesthetic course that I could find, and it grew my practice quite a lot. So what I did is eventually I phased out my general practice, and in 2010 I decided to do aesthetic medicine full-time. The industry is involved tremendously, so it's one of the, I think, fastest growing industries in the world. There's new techniques, there's new technologies, new products that actually comes on every year. So yeah, and it's an amazing industry. It grows, and it's gone from leaps to bounds over the last, say, 20 years. My philosophy of minimum invasive treatments for maximum results is that I believe that you don't need to over-treat to get great results. You can use a small amount of product. If you put it in the right place, you can get great results. If you know your anatomy well, if you know your facial dimensions, it's very easy to take a small amount of product, put it in the right place, and get great results. And that's how I approach my treatment when I look at my patients. What sets my practice apart is I try and do it as natural as possible. And that, for me, it's important not to change the character of your patient's face. So the Reshape program that I created in 2003 is a lower dose with less side effects, but with still great results. So over the years, I've tweaked it a little bit. I've added some supplements, and obviously the industry has grown quite a lot on the weight loss front. So I've managed to add and do different things to fit in with lifestyle change, which is very important for me. So you have to evolve regularly and look at new technologies. And I believe there's a place for everything, for all those drugs, if it's used correctly, if it's done by a doctor under supervision, and if you use the original authentic products that's available in the market. As an international trainer for Ipsen and Galderma, we train on fillers, skin boosters, we do toxins. I think it's very important for young doctors to know their anatomy. If you know your anatomy, you would know where to put your products. It's also important that you enjoy what you do. So if you love your skill, you would want to enhance it and to learn as much as possible about what you do. And also it's important to use products that are credible, that's authentic, and that's registered. So that's something that we need to make sure, and I try and focus and push it to the doctors, that you have to make sure you use good products, know your anatomy, and love what you do. So the role of PRP in modern aesthetic medicine is quite important. It's something that I discovered quite early in my aesthetic career, and it just makes perfect sense to me. So if you use your body's own healing abilities to treat anti-aging, scarring, collagen stimulation, it's an absolute no-brainer. So for me, I try and incorporate as much as I can in most of my treatments. I love to mix it or combine it with hyaluronic acid and succinic acid, which is something that will help pigmentation, scarring, as well as fine lines and stimulate collagen. In hair loss, I use it quite a lot to stimulate hair growth. That you can combine with carboxytherapy, with topical products, microneedling, minoxidil. There's a lot of combinations that you can do with PRP. To explain what PRP is, it's taking your own blood, spinning it off, so putting in a centrifuge, separating the red cells and the hemoglobin from the plasma. So the plasma is the part, looks like straw-colored substance. It's got all your growth factors, stem cell, platelets in. So that's the healing part of your blood. So whenever you've got an injury somewhere in your body, your healing properties in your blood will go there and basically fix the problem. So if you create an injury like microneedling or in your face and you want it to heal, and you add your platelet-rich plasma or your own cells, you create 10 times more collagen and elastin, and that's kind of what you want. So my collaboration with Dr. Jansen van Rensburg is to fill a gap in the medical industry. So in a way, we're very lucky in South Africa that we've got quite a lot of good basic training programs to teach young doctors how to do aesthetics. But from personal experience and how my journey sort of started and ended, there's a gap. So when you start your basic training and until you start injecting, there's a confidence issue, I think, and you also don't understand the industry as well. So we're trying to help a doctor from when they start their training until they start injecting to get confidence. So we do small groups of doctors, not more than 6. We train them on different aspects of aesthetic medicine, and it's a kind of a one-on-one. And we also help them to learn about the business of aesthetics. So not just about how to inject, but how to run your business, how you to understand what you're doing, how are you doing it. So I think it's an amazing journey. We're still young in the process. We've just started recently, but I think it's going to be a great collaboration. To keep abreast with the current techniques and technologies, I'm lucky in a way that I'm a trainer, so we get trained on a regular basis by international trainers and by local trainers. So on an annual basis, we get together, we get training in all different aspects of aesthetic medicine. Obviously the products that we train on, as well as how to present yourself, how to teach other doctors. So yeah, so in that sense I must say I'm quite lucky, but also just reading up on whatever you can. If I've got an interesting topic that I want to, I mean, the internet's an amazing place, just educate yourself. So yeah, so that is how I sort of keep up with the latest technologies. Yeah, the biggest misconceptions I find in my practice that patients have or clients have is they sometimes think more is better. And that's quite important when you look at certain results that you get from patients. You've got to be very careful with that. Also, that some patients or clients think that it's a very expensive thing to do, and it's not necessarily. You can do small treatments over a long period of time. It doesn't have to cost an arm and a leg. Also, patients tend to think that they want quick results. It's not an instant result. You need to be able to understand the concept of it's a process. So aging doesn't stop after I've done your toxin. We have to do other stuff as well, and we have to continue the treatment. So that's kind of what I try and instill into my patients, that you got to carry on with the treatment on a regular basis. So for me, combining treatments and getting better results is what my practice is all about. I believe in combinations. So combining PRP, obviously, as I said before, is one of my big treatment plans. So in other words, using PRP with hyaluronic acid, using PRP on its own. Then you've got combinations with fillers. So we do a filler with a biostimulator, and then we call it a firm and lift. So you can combine those two. You can combine skin boosters with chemical peels. You can do micro needling with chemical peels. So there's a lot of different combinations. My personal favorite would be the firm and lift. So it's to do the biostimulator with polylactic acid, and then adding a filler to give you that little bit of a definition, and you can see the results immediately. So for me, that's my favorite. Second to maybe PRP. Innovations that's going to shape the future in aesthetic medicine, probably not just in South Africa, but in the whole world, in my opinion, it's like most things, is AI. I think AI is an amazing tool that we can use to enhance our treatments. It's also there's a lot of nice assessment tools that you can do with AI. And then on a medical medicine point of view, peptide therapy for topical as well as injectable for lifestyle change is very important. You can combine that. Obviously you have to combine it with sleep, diet and exercise to get great results. Exosomes also, it's also quite new. It's just basically messengers that you send, that you put on your skin or take, that'll send a message to your body to do certain things. So for me, if I think that probably would be the few big things that's happening. Stem cells is also massive. Stem cells obviously from your blood, but from fat, which is a little bit more concentrated and gives you better results. So yeah, there's a lot of exciting stuff out there, I'm excited about the future of aesthetic medicine in South Africa. So my biggest tip that I can give to prevent anti-aging would be sunblock. So sunblock. So if there's only one product you can afford or you want to use a good quality sunblock, and that's probably my biggest tip that it'll give you. And then second to that will be smoking. Smoking is such a damager in the sense of causing damage to your skin, your body. Those will probably be my number 2 one. And I mean, eating healthy, drinking lots of water, just the normal lifestyle things that you can do to slow down aging. It's not really rocket science, but it's something that you need to do.